Now is not the time to make this change.
We should reconsider this decision.
There seems to be no basis on which the Minister has made this decision.
From Jan 1, the number of psychology sessions Aussies can claim on Medicare will drop from 20 to 10. Now the opposition, crossbenchers, medical experts and even Labor's own backbenchers are demanding the government reverse its decision.
Honestly, I was absolutely devastated by this announcement. We're worried that the government is actually sending a message that mental health care is being deprioritised.
In 2020, as COVID surged and lockdowns began, the government doubled the Better Access initiative, giving Aussies Medicare rebates for up to 20 psychology sessions per year. But a new evaluation from the University of Melbourne shows that it drove a big increase to the sector.
It found that those additional 10 aggravated existing wait lists and aggravated barriers to access.
Last week, the Health Minister said the benefits primarily went to higher income Australians who were already in therapy, leaving fewer places for lower income Aussies the scheme was meant to benefit.
The number of new patients who are able to get into the system and get access to psychology service actually declined by 7% over the course of that period.
The Morrison government's extension of the program was always a temporary measure, set to expire at the end of this year. The new Health Minister says he'll bring together stakeholders in the new year to look at creating a more equitable system.
We think that a lot of people are going to be deprioritising seeing a psychologist because of the cost factor. We've been in a mental health crisis for the last 3 years because of the COVID-19 pandemic. If we're encouraging people to be accessing services, those services need to be available.
I think we can all think of measures that were introduced during the pandemic that were specifically related to that moment in time, like JobSeeker, JobKeeper, some of the telehealth measures as well. And I think we all understood that eventually they would be phased out. It strikes me that mental health may be slightly different to the others because we're all aware of the long tail of COVID, right? We all know people in our lives that are struggling sort of at this end of the whole thing. But I think what's also interesting is that in that report that the Minister is referring to, one of the recommendations was that you should actually keep the additional, even though there are those problems with it in terms of creating further barriers to entry. But maybe the GP should be cutting in at the first 10 to recommend whether the other 10 becomes available, which seems like a reasonable compromise, at least on the face of it.
I think there's obviously, like, life's gone back to normal, so there's a sense of like, oh, well, COVID's behind us. But I think this probably needs to be a discussion that puts COVID aside and just says that how could we make mental health services more accessible to people who can't afford it? Because actually the implications for all your health, if you're not looking after those kind of things, can be massive and then put huge strain on the system. And those kind of services are really important to be able to access, especially if you can't, you know, it can't just be something that is for people who earn it above a certain level.
But don't you think as well with this, in terms of looking back on COVID, it's kind of saying, well, we're not still suffering from mental health issues because of COVID. Like, COVID's done now, we can move past it. And I think that it can't be just a simple black and white system in this case. Like, it needs to still have the infrastructure around it. Or maybe that money then goes back into bringing in more psychiatrists, really putting time and energy into how we create more spots so that the people who have a lower income are not missing out, but there's just more access in general.